Alfie here once again at Untitled Pain Relief Clinic, and it's been quite a while since I did a video that deals with something clinical. So today I wanted to talk a little bit about a muscle called the Iliopsoas. It's the most powerful hip flexor in the human body. So to help me with this, I have Skelly here. Skelly is going to be a demonstration model to help us learn about the Iliopsoas muscle. So the Iliopsoas muscle is actually two muscles in one. It's a muscle called Iliacus, psoas major and minor, and Iliacus. They combine to form one muscle. If you want to break it down, psoas major and minor is actually three. And it attaches to your inner thigh. So it runs from your lower thoracic spine, your lumbar spine, into your pelvis and into your inner thigh here. This is not because Skelly's broken. This schematic here is to demonstrate what this muscle does and the problems that can lie with having tightness of this particular muscle. So as you can see, Skelly here, what this muscle does is it basically brings the thigh towards the chest, just like this. So it does something called hip flexion. Okay. It also does this. So if you're lying on your back, attempting to do a sit-up, this muscle actually kicks in to bring your upper body towards the sky, right? So you're kind of bending forward, doing that sit-up motion. If you're doing it correctly, this muscle kicks in more than it should, right? So the reason why it's important is that this muscle is important is that many people come into the clinic with lower back pain, with hip pain, with lower extremity pain. They could have thigh pain, groin pain, even mid-back pain. Okay, and they've gone to different therapies. They've done different. They've seen different therapists, and what they found is that there is they haven't found much of a change in terms of their condition. And the issue is that, for example, with the lower back, it could be more symptomatic in the lower back or symptomatic in the hip. That's where the problem might feel like it is, but it could be stemming from somewhere else, right? And that's the reason why I'm kind of mentioning this. So this muscle here, Iliopsoas, I have to say from a clinical standpoint, barring any medical tests that show positive, a lot of the times when it's a soft tissue issue, it's actually coming from here and not the lower back. I'm not even say like about 90%. I'm sure there's going to be some therapists that'll debate this with me, but this is what I found. And the reason why I say that is that I've found that over time there's been more long-term comfort after getting treatment on the Iliopsoas as opposed to actually working on, say, the area that's complained about, like the lower back or the hip. Not to say that you ignore those spots, but from my standpoint, it's more symptomatic there as opposed to the root problem is there, okay? So another thing that I want to mention is that, like with muscles, I tell this to patients all the time, don't look at it as flesh. Look at muscles like ropes, right? So, engineers, people that are mechanics would understand this, and I'm hoping that you will, if you're not a mechanic or an engineer, using Skelly here. So if you visualize these ropes pulling in one direction, you could see that certain structures will be pulled towards that direction. Maybe the other ropes on the other side have to adjust because there's more pull towards a certain direction, as mentioned. So for example, let's look at this. You have one side here that's pulling more so. This muscle becomes very, very tight on this one side. You can see that potentially there could be a shift of the lower back, the spine going this direction here. Right? So if you're, for example, sitting for prolonged periods, your thigh is in this position. It's a hip flex position. What happens is that this muscle becomes very, very tight over time. So if you're sitting down for 6 to 8 hours, maybe going home and sitting like this while you're doing your work, this muscle literally gets short. And what that means is that this muscle can pull on structures such as the lower back here, the lumbar spine. It'll pull it forward. I'm going to bring Skelly here sideways, forward, and cause more of a curve, potentially causing an irritation of the joints of the lumbar spine, causing a lower back issue. So whenever like a joint's irritated, you could get muscle spasms in the region causing pain. So what will happen is the person comes in and they'll show with lower back issues, or they'll tell me they have lower back issues. They've had chronic issues, from lower back, and they don't know what to do. As soon as I check to see how tight this muscle is, I found for the most part it generally is very, very tight. And I think one of the big reasons for that is that today our jobs are more white collar. We sit a lot more, and therefore we have more shortening of the iliopsoas muscle. So another key piece that you should understand is that if you notice, it's somewhat attached centrally to the center of the body here, right? I say somewhat because it's not quite exact. But when that happens, what could potentially happen is that not only will you get issues like in the lower back and the hips, but if you can see here, side view wise, you can see that there could be some issues, maybe pain, maybe tightness around the mid-back here, right? So whenever the iliopsoas becomes very tight, the muscles of the back have to adjust according to how tight it is, right? So these muscles become tight, they become more spasmed, but once we start relaxing the iliopsoas muscle, there's a noticeable change in the way that the lower back feels. The muscles become a lot softer. There's more motion that I notice with my hands as I'm working on those areas. So here's a couple of things to note in regards to discomfort and pain that you might notice with the iliopsoas. So one key thing that I ask of patients is, when they go from a seated to a standing position, do they feel like they're being kind of pulled forward, right? That's, for me, if they say yes, that's a probable indicator that it is the iliopsoas muscle that could be problematic and causing the person the lower back issues. So from a percentage standpoint, I'm guessing that about maybe 90% of the people actually have more hip flexor issues than lower back issues. It's just showing more symptomatically in the lower back. Anyways, I just wanted to teach you about that so you have an idea as to why maybe you're not feeling better, or you're feeling minimal changes in regards to treatment. Maybe it just needs to be looked at with different eyes. Anyways, Alfie here again at Vente Pain Relief Clinic. If you've got questions, feel free to call us at 416-644-8894 or email us at admin@ventepainrelief.ca. Ask for Skelly. Just kidding. I'm just kidding. But anyways, have yourself a great day. I hope this video helped. Take care.